This segment of Delmarva Life is brought to you by Peninsula Home Care.
Well, before the break, we discussed colorectal cancer, its symptoms and risk factors. Now, if you are diagnosed with the disease, undergoing treatment for it can be quite the process. So you want to be as comfortable as possible. Perhaps you should consider chemotherapy within the comfort of your own home. Did you know there is such a thing? Well, joining us today to tell us more is Therese Ganster, who's the branch director at Peninsula Home Care in Ocean Pines. Thanks for coming in, Therese. Appreciate that.
Thank you.
So a lot of people didn't even know something like this existed, offering chemotherapy in the home.
Yes.
Why is that a big deal?
Why is it? Because it is so much more comfortable for the patient, and it's probably also better from an infection perspective, because as you know, when you go into the hospital, there's a lot of cold and flu going around, and you can control your own environment a little bit easier when you're in your own home.
Oh, okay. So what's the process in chemotherapy in your home?
It's actually pretty easy. Once you've acknowledged that you're going to have chemotherapy, in an outpatient setting or an inpatient setting, they'll put a line in underneath your skin about here. Yeah. And then once that's in, the physician outpatient chemotherapy area or a physician's office will start it. And they'll basically take one of the pumps that kind of looks like this.
Okay.
And they'll say, okay, we're ready to get your chemo, which will be kind of coming in an area of this process. Okay. And it'll be in a cartridge. Right. And basically they'll say, okay, we have about 48 hours that we're going to hook you up. So they'll hook you up within that day or the next day. We'll come out, make sure everything's okay, go through the criteria of what you should do while you have chemotherapy in the home. We open for any kind of questions that you may have. And then 48 hours later, we take it out and you're done. Okay, so with this, you're mobile. You can move around the house. Very mobile. You can go anywhere. You can rest in your own bed. You can get up and have breakfast. You can read your favorite book. You can watch Delmarva Life. You can do just anything you want to. Just about whatever you want. You said it takes maybe about 48 hours for the... About 48 hours. Wow, that's pretty incredible. So you get to stay in the comfort of your own home. Can all cancer patients receive their chemotherapy like this? Unfortunately not. The drug that they use is called 5-FU, and that is a mixture of chemo, but it is not as much of a cocktail, so to speak, as some of the others. So the only ones that we can do in the home right now is colon cancer and breast cancer. Can any nurse help out with this? Not in Peninsula Home Care. Okay. We ensure that all are chemo certified. We want to make sure that all of our nurses know all of the nuances, all of the details, any of the issues or problems that may occur. Because there's certain safety factors that are involved here too, right? Absolutely. Like what? I mean, what's with the yellow bucket here? This is our biohazard waste bucket. And so basically, remember that chemotherapy is it's serious chemical business here. Right. Yeah. And so you want to be able to make sure that you are taking a good, clean environment in your own home, and you're washing your hands. If you look and see, we are talking on there, we already talked about the waste bin. We also want to make sure that when you have someone and you're taking your people and pets away, right, more so children. Remember that dogs and cats like to play, and they may want to decide that they want to play with that line. And if that line comes off, then we have to make sure that you wash your linens, that you're taking more precautions, making sure that you put everything in the biohazard waste basket. And also for children. People themselves, they're more adept, but make sure that they don't have any colds or flus so that your immune system is okay in the process. It's still serious business, but it is something you can do at home. Yes. And you have a personal buy-in into this, don't you? I do. My mom was diagnosed with colon cancer. Well, we lost her 8 years ago, but she was diagnosed, and she was one of the first to have the quesabetamine or the Xeloda, which was a chemo that you take orally. And then when that wasn't working, she started taking the chemo in the home. And her quality of life was wonderful for 9 years. She went through a course of 4 different chemotherapies. She lost her hair 4 different times. Sometimes it came back curly, sometimes it came back straight. The last time it came back snow white, which was absolutely beautiful. And her quality of life was great. In between chemotherapies, she would wear her gloves and she'd do her gardening. She loved to, we had probably about an acre of lawn, and so she would get on her ride-em lawnmower with her little baseball cap and go around and do what she needed to do. She loved to come visiting the beach. That's why we moved here.
Oh my goodness. So it's all about quality of life, being comfortable.
Absolutely. Absolutely.
And this is a good thing for that. Great. But now, if you have any questions, it's important to ask your nurse.
Absolutely. And we are available 24 hours a day, 7 days a week. So please, if you are a patient of ours and you're getting chemotherapy, please, please, please don't be afraid to call. Any patient, anytime. Call.
Therese, thank you so much for coming this afternoon.
Thank you.
Some marvelous information there. If you'd like to know more about chemotherapy from Peninsula Home Care, it's easy. Just go to delmarvalife.com and click on the Show tab.